Doctors are growing more and more concerned about the recent rise in kids using drugs and alcohol.
A new study out shows there may be gross underreporting of opioid-related deaths.
And that 100,000 people, those are the ones we know of.
America's public enemy number one in the United States is drug abuse.
Long before modern medicine, people have used psychoactive drugs for their health and spiritual needs. This ancient practice is where our understanding of addiction and the first steps towards treating it began. Mesopotamians were among the first to document the use of drugs for medicinal purposes. Clay tablets dating back to 3000 BC contain references to the use of opium for its sedative effects. Similarly, the ancient Egyptians revered opium for its soothing properties and included it in their medical practices. The Ebers Papyrus, an ancient Egyptian medical text with herbal knowledge dating back to around 1550 BC, references opium in both its sedative and hypnotizing-like effects. The knowledge and use of drugs, especially alcohol, continued to prevail and flourish throughout history in different cultures, religions, and societies around the world. Fast forward to the 18th century, and figures like Benjamin Rush, a pioneering physician and one of the founding fathers of the United States, emerged. At that time, he founded revolutionary ideas, one of which included the recognition of addiction as a disease and the necessity to help patients suffering from it. As the 19th century unfolded, inebriated asylums opened their doors, providing solace to those afflicted by addiction. Yet, these institutions often mirrored the harsh judgments of society, relegating their inhabitants to the shadows of disdain. Addiction wasn't seen through the lens of medical understanding, but rather as a moral failing. The prevailing belief was that individuals simply lacked the willpower to resist the temptation of substances. The passage of the Harrison Narcotics Tax Act in 1914 marked a turning point in drug policy, criminalizing the non-medical use of opiates and cocaine. As a result, individuals with substance use disorders were increasingly viewed as criminals rather than patients in need of treatment. However, in 1935, Bill Wilson and Dr. Bob Smith founded Alcoholics Anonymous, or AA, which introduced a 12-step model of recovery. AA's success inspired the development of similar programs in other substances, including Narcotics Anonymous and Cocaine Anonymous. As we move into the 21st century, our understanding of addiction as a disease furthered. Advancements in legislation like the passing of the Mental Health Parity and Addiction Equity Act in 2008 broke down unjust inequalities between other medical treatments and treatments for mental illnesses, systematically taking down barriers for people to get treatment and help. The knowledge of drugs and their effects has been known for thousands of years, yet the journey of addiction treatment has been marked by struggles and triumphs, setbacks, and progress. Bringing up the history and development for our knowledge and treatment of substance use disorder reveals how impactful of a role drug plays in society, and also begs the question, what is the state of treatment like now, and is it working?
Today's approach to rehabilitation bears little resemblance to the methods used in the 20th century. To learn more about modern rehabilitation practices, I visited the Rogers Behavioral Health Rehab Center in Milwaukee, Wisconsin, where I spoke with nurse Janice Smith, who has 38 years of nursing experience. Nurse Smith outlined the process for individuals admitted to the hospital due to intoxication. First, they undergo detoxification to eliminate addictive substances from their bodies and manage withdrawal symptoms. This phase typically lasts from a few days to a few weeks. Following detoxification, patients then choose between inpatient treatment in a hospital or residential care, both offering controlled environments to focus on rehabilitation. The next stage is outpatient care, exemplified by Rogers' program, where patients attend customized therapy sessions. This allows them to start reintegrating into their daily lives while continuing treatment. Outpatient care programs are very dynamic and adaptive, and nurses are constantly monitoring patients' needs and the effectiveness of their program. Throughout this process, family involvement is crucial, from intervention meetings with family members to discuss treatment progress, to measures ensuring the safety of the patients. Successful outpatient care leads to aftercare support, including counseling and therapy, essential for maintaining sobriety. These programs not only focus on recovery from substance use disorder, but also equip patients with tools and resources to navigate challenging moments without turning to substances.
That's a huge part of what we're doing here, is trying to give people skills and tools, because we're not going to make the world a bright and shiny, happy place. There are a lot of difficult things that happen to a lot of people all over the world.
However, this journey is far from easy. In order to illustrate the complexity of this process, we wanted to turn to the classics and draw inspiration from the voyage of Odysseus. The Odyssey, written by Homer around 700 BCE, is the 10-year journey of King Odysseus to return home to Ithaca after the Trojan War. By the way, this is the guy who masterminded the famous Trojan horse. However, his journey was not straightforward. Here is a map of the Mediterranean. Now here is Troy, and there is Ithaca. Normally, one would expect a journey like this to be straightforward and easy. Just travel by boat this way on this path. Now here is the journey of Odysseus. It's messy, it's complicated. Sometimes Odysseus found himself going back to a place that he was at before, or passing by it. And on numerous occasions, he came so close to his destination, and yet was still pulled away from it again. Similarly, those facing substance use disorder are on a personal odyssey towards healing and sobriety. This journey is seldom linear. Like Odysseus' voyage, it can be long, tedious, brutal, and they can be full of relapses and challenges that test their resolve, often requiring them to revisit past struggles or come tantalizingly close to their goals, only to face new obstacles. The path can be messy, as addiction is a disease that has hijacked its victims' minds. Patients may have to go through this process many times until they find success.
One of the most difficult things in addiction recovery is sometimes the first time through a program, a person's not successful. They may have to go through 2, 3, typically it's 5 to 7 times until it finally overrides that whatever switched on in their brain to make the substance be the primary motivator in life. Addiction recovery is a lot of work. It's worth it to be able to live your life and embrace joy.
However, one of the things that makes the journey of someone with substance use disorder different from the Odyssey is societal misconceptions, mistreatment, and stereotypes of addiction. And this is not a new problem. It's a problem that has persisted for a very long time. Often, substance use disorder is thought of a moral failing, that the patient with it chose their circumstances.
This really is a disease. People come in with a lot of shame and guilt, and having heard from their family and even their own inner critic, how many times have they heard, "Why can't you just stop?" And unfortunately, that's not a helpful question.
Addiction can happen to anybody, and we tend to have this notion of like it's the sketchy guy in the alley, or the person that you really don't want to talk to, but it's not that way anymore. It's usually like it's someone's grandmother, it's someone's mother, it's someone's sister, someone's brother. Anybody can be addicted.
That no one says when they're a kid, "Ooh, I hope I get to grow up and be an addict," right? That's not somebody's lifelong dream. Something brought you to this path.
Yet the stigma persists. The belief that individuals with substance use disorder are solely responsible for their situation due to making poor choices. Even though we must recognize that addiction isn't isolated. If there's one thing you should derive from this, it's this. Addiction is not a choice, it's a disease. So where does this journey take us? We've talked about the past and present state of rehabilitation, how difficult the journey is for someone with substance use disorder as they navigate their life towards healing. But we have yet to talk about the future of this issue. What can all of us do to aid the journey of recovery for patients? And for this, I would like to introduce one possible answer to this question. COYAD, or Council of Youth Anti-Drug.
My name is Master Duke Lee. I'm a master in Taekwondo.
And my name is Nancy Lin, and I'm a project manager at Northwestern Mutual.
COYAD is stands for Council of Youth Anti-Drug. and our mission is to build healthy network for youth by providing leadership training and drug education for a meaningful life.
COYAD and other organizations like it are key players in shaping the future of rehabilitation. Throughout education and community engagement, COYAD teaches leadership skills and raises awareness about the dangers of drug use, particularly among young people. Kids as early as age 11 can be seen being involved in the program, asking questions and understanding how these drugs work, how they can be introduced into an individual's life, and eventually how detrimental to that person's life they can be. COYAD is a growing program, and as it grows, it is sparking much needed change in the world, a change full of education, training, and community building to fight a growing problem that can affect anyone.
So essentially, the drug prevention education is a multi-layer approach. So what that means is education has to be there. Parents have to be involved. The community needs to support. And once this area come together in order to facilitate the mission, that's when it could be addressed effectively. And by reducing drug abuse and empower our youth, we're definitely helping them to inform them to make right choices and build a great future for their lives.
But COYAD and organizations like it are just one part of the solution. It's important for all of us to continue to raise understanding of this issue. It's a problem that can affect anyone. And if we can break down the social stigma and any barriers to getting help, we are much closer to helping patients through their journey of constant battle and strife, like that which Odysseus faced, so that they can finally return home.